All right. Hi, everybody, and welcome to part two. For today's presentation, I have just shared a link in the chat to the presentation. There's going to be a lot of content in today's presentation, and so just want to make sure that everybody can follow along and click through to the different resources as they see fit. So could someone confirm that they can see the start to the presentation?
I can see it.
Looks good.
All right, thanks, Ashton. Great. So who are we? My name is Sydney Gregory. My pronouns are she and her. I'm from the Red Hat neurodiversity community, and I'm a volunteer with Red Hat Pride. We are volunteer-led groups focused on diversity and inclusion within Red Hat. We help our community members build stronger and internal and external networks, offer social, educational, and outreach activities, and create development opportunities for future leaders. I've also got on the call with me today Ash Davis, who I'm going to give an opportunity to introduce himself as well.
Yeah, so I'm Ash Davis. My pronouns are he, him. I work at Red Hat. I work in the solution architecture department, organization, and I am also part of the leadership council for Red Hat Pride, and I am a member of Red Hat Neurodiversity.
Thanks so much. Ash will be helping me out with some of the content today that you'll see, and we'll also be helping with questions and just kind of popping in. And we're excited to be here today. We're excited to be joined by NAMI Wake County and NAMI North Carolina, as well as the LGBT Center of Raleigh. NAMI works to bring free support groups, classes, and informational events to thousands in the community and the state. And the LGBT Center supports the Triangle with programming events for the gay, lesbian, bi, and trans community. So as I mentioned, this is part two of a two-part event. The first part we dubbed Personal Coping. And this was basically just an overview of what LGBTQ plus mental health was like and the intersection there. We had some great storytelling from our panelists. LGBTQ plus individuals are 3 times more likely to experience a mental health condition than non-LGBTQ plus individuals. Transgender individuals are nearly 4 times as likely as cisgender individuals to experience a mental health condition and to experience a substance use disorder. And actually 40% of transgender individuals in the US have attempted suicide in their lifetime, compared to less than 5% of the general population. We learned about some, all these statistics are very sobering. There's hope for a more inclusive future. We look to our allies to take the time to listen and learn about the community, to really work on themselves, be a role model for kindness, compassion, and inclusion, inspire trust and respect, and to allow others to be authentic around you and come into their most authentic selves, and to just know, support, and protect LGBTQ rights, which we will go into today. So part 2 is professional coping. How do you bring that authenticity to the workplace? And what does it look like to be out, have a mental health condition in the workplace? So today we'll cover coming out and your responsibility to yourself and your personal safety, your rights in the workplace, and how and when to talk to your managers and peers. Just a disclaimer, the content presented should not be considered professional, legal, or medical advice. You heard Ash's role at Red Hat. I am a marketing specialist working in enablement, so we are definitely not medical or legal professionals. We've just done a lot of research. We're going to present information from our experiences that we hope will be helpful, and we have tried to make the content as accurate as possible, and we've also cited, so that's why you've got the link to the deck. So that's just a big disclaimer, but we have done our best, and we hope that this will be helpful to y'all. So on coming out in the workplace, whether you choose to be out or not, it's definitely a personal decision. I love this quote here from Ruby Rose, that only you know who you were born to be, and you need to be free to be that person. So to that effect, I'd like to start with talking about psychological safety. Psychological safety is a much touted topic in business communities and the neurodiversity community as well. It's just the belief that I will not be punished or humiliated for speaking up, especially things like pointing out mistakes or having a dissenting opinion. This became very trendy as a concept from Google's Project Aristotle that proved they surveyed a lot of the highest performing teams at Google and found that the highest thing they had in common was psychological safety. And it was actually the most important piece of high performing teams. What does that mean for someone who is out in the workplace? It means that you're really at a disadvantage if you're not psychologically safe. I'm sure that's not a surprise to anyone, but there are things that you can do to have some control over your own psychological safety, and especially if you're a leader, to create psychological safety. So if you're in a leadership position, or if you are in a place to expand safety and you feel personally safe, you can acknowledge your own mistakes, be mindful of how you react to the mistakes of others. It's always a good idea to listen more than you speak. Encourage others, especially disenfranchised groups, to speak up and ask for help, and take extra steps to encourage clarity for everyone, and be very mindful of what that clarity might look like. Again, if you're not safe, definitely, there's unfortunately situations where that's the case. We don't recommend coming out in those environments or taking any of these steps, but you can try to manage up with compassion and think about the background and where your leadership is coming from, but never take their actions personally. And most importantly, realize when it's time to move on. Unfortunately, situations do turn toxic pretty quickly, and there are going to be times when it's not the best place for you, and it's best for your mental health to get out of there. For those of us who are on the call as allies, realize that psychological safety is a privilege, and it's more often afforded to heteronormative, cisgendered, and neurotypical individuals. It's something that is sad but true, that when you are quote unquote normal, you are going to feel psychological safety more frequently, because systems were designed to make you feel that way. Out or not, you'll always be a victim of others' biases. So these are just a lot of things to think about when we're talking about coming out in the workplace. So a lot of people don't know you can actually come out as neurodiverse. It is actually a thing in the community where you come out with a mental condition, but know that it's not anyone's business. Neurodiversity, sexuality, and even gender identity can be invisible at times. And so you're really entitled to that privacy. You shouldn't be punished or humiliated for being yourself, and it's your choice to disclose. Some advice from my experience, and I'll let Ashton jump in here as well. To describe your experience more than name it, bipolar or ADHD, or even gay or trans or bi, any of these words are going to have preconceived notions, and they and biases along with them. So symptoms or describing your experience may be a better route to getting understanding. Queer is a term that's more frequently being used to be intentionally ambiguous, so that may be a safe way for you to be out at work. Know that you can be out to some, but not to all. There's a lot of pressure to be out to everyone, and certainly in the Pride community, we want people to be out when it's safe for them, but there's also pockets of safety we want to be mindful of. And you want to set or reset expectations with yourself that you will need to do this over and over again, sometimes with each interaction and sometimes with the same people over and over again. It's a lot of fun. Ashton, did you have anything you wanted to add to your experience here, or psychological safety as a general concept?
Oh yeah. So in a couple of things, I think one of the things that's cool about psychological safety is not being alone. And this is part of why, we encourage the use of pronouns and the volunteering of pronouns. We want to normalize it, and that is part of psychological safety. Similarly, I think it's important that if we are in a position where we feel comfortable enough to speak about our own neurodiversity or our intersection therein, it creates space for others as well. There were people who blazed a trail about being open with their lived experience with mental illness before I did, that made me comfortable coming out and talking about it. One of the things I do think is important is it is through personal experience and lived experience that we demystify things. Bipolar is a good example of a much maligned and not well understood by the public mental illness. And it is one that has been shaped and changed and redefined in every DSM that has come out. And yet the public has this image of bipolar equals crazy, and that's just not fair. But describing what it feels like to have mood instability is a much different way to approach it than to say I'm bipolar. And it will help, I think, other people understand as well, because part of coming out is helping people that haven't had these lived experiences understand what it's like. So I think it's important as well to speak to lived experience and to prioritize that over a diagnosis code that people are just not likely to understand.
I love that perspective. Thank you so much. It is important to share what your lived experience is. It's kind of the gateway to allyship, and it's the gateway to understanding. Another aspect I thought it was important to cover would be the cost of exclusivity. So it's a mental toll to be in the closet, either with a neurodiverse condition or being gay, trans, bi, anywhere on the LGBTQIA plus spectrum. You can feel low energy and have low productivity. You'll feel excluded and perhaps not part of the team. You could experience low morale. And I have a great resource I point out in a few slides, but that really takes to the time that it wastes to be in the closet. But you just spend so much time trying to figure out if someone gets it, keeping track of who knows what, explaining yourself to people who don't understand, doing the emotional labor that's involved with that, of like being a representative for your intersection, and setting boundaries that may otherwise not be needed. Great work also comes from a diversity of thought. So in the workplace, that intersection that you're bringing something really, really valuable to your company because you're who you are. And the perception of that quality is going to depend on building understanding with your coworkers and with your manager about who you are and where your perspective is coming from. So when it's safe for you to come out of the closet, we hope that these things might go away, but we understand that like these are things that I've certainly felt, even being out. So it's unfortunate, but it is costly. Why should business leaders care about this? I hope that with this information, you can, if you're not coming from Red Hat or one of the organizations represented here today, maybe you can take this back. But to attract and retain talent is more critical now than it ever has been. Fortune 500 companies have grown to support LGBTQ plus people and putting policies in place to protect discrimination, from 4% in 1996 to 91% in 2019. And gender identity discrimination policies grew from 3% to 83% by 2019. We're also seeing employee resource groups crop up at Red Hat. We call them diversity and inclusion groups. And these are very attractive to candidates. To retain talent, going back to that idea of psychological safety, to keep people around, they need to feel safe. Half of LGBTQ plus employees stay closeted at work, and LGBTQ plus people of color continue to face added challenges at their intersection of these identities and discrimination, representation, and economic opportunity. So it's sobering, but fixable to retain your talent, make your spaces safer, and have employee resource groups and have policies to protect discrimination. Also, liability. It's just the fact of the matter that we live in America. I think this invite went out globally to Red Hat, but other countries are equally as litigious. It is a huge liability to have discrimination happening in the workplace. 40% of the transgender community have reported experiencing serious psychological distress. 37% of LGBTQ plus individuals have reported experiencing workplace harassment in the last 5 years. Nearly 43% of gay individuals and 90% of transgender individuals have faced harassment or mistreatment on the job. It's absolutely unacceptable. But these are facts from reliable reports, and companies should really start to care about this. It's opening them up, especially as the world changes around us and there's more legal protections, which we'll go into. it's more important than ever for workplaces to open up and allow people to be safe to come out in these ways. So this is the resource I mentioned. I would encourage you to download and share it widely. The fabulous John Martin at Red Hat created this. It's just an infographic that takes you through a scenario of a gay man talking about his weekend on a Monday morning and what these different conversations like and what the toll of being in the closet is. So I hope that you'll find that useful. Now we'll go into your rights in the workplace. This is going to be a little bit drier material, but we'll try to keep it interesting. With psychological safety, it's very important to know what ways you're legally safe and what ways you're protected. So wanted to make sure to present this information to you today. So the Civil Rights Act of 1964 was expanded in 2020 to say you cannot be fired for your sexual orientation or gender identity. For our friends at small companies, fewer than 15 people, unfortunately, that's not protected. This does have some gaps. This was a huge landmark decision for LGBTQ plus individuals in the United States, but unfortunately doesn't prevent you from being denied medical coverage. Doesn't prevent you from having to use the incorrect bathroom or an unacceptable bathroom or to wear a uniform of your choice. And there's a huge gap around whether the employer may be able to defend their actions with their religion. So it's good to know where we stand when it comes to our rights legally in the United States. I'll give some resources if you're joining us globally to find your rights elsewhere. As far as neurodiversity and mental health, under the Mental Health Parity Act, insurance companies have requirements to their mental health coverage offerings. So your health plan must provide you information about mental health and substance use disorder benefits at your request. This includes any criteria that they use to decide whether your treatment is necessary or not. They can decide that it's unnecessary. They can deny payment, but they must give you a written explanation for the reason of that denial, and they have to give you more information on request. If for some reason they do not provide you with enough information, or they have closed the case on not providing you payment, you have the right to appeal, and there are agencies that can support you in that endeavor that I've linked in the sources below. Under the Americans with Disability Act of 1990, it's illegal for an employer to discriminate against you because you have a mental health condition. This includes firing you, rejecting you for promotion, or forcing you to take leave if they deem you with a mental health condition. It also protects you if you're being harassed because of your mental health condition. So things look a little bit better for those of us with mental health conditions. You do not have to tell your employer that you have a condition. You do not have to disclose gender or sexuality. There's really nothing that you can be forced to state in the workplace. The only time your employer can ask medical questions are under these certain criteria. So if you ask for reasonable accommodation, which we'll go into a little bit shortly, if anyone else in the same job category is also asked the same questions after a job offer is extended. So they can only ask questions. It can't be a part of their criteria for hiring you or not hiring you, more importantly. If they're fulfilling federal affirmative actions compliance, you can decline to disclose, but there may be surveying that happens. Red Hat just went through this exercise where we're trying to encourage folks to self-identify, but if you're uncomfortable or feel it's unsafe, you absolutely don't have to. And if there's objective evidence that you can't do your job or that you might pose as a safety risk because of your mental condition, unfortunately, objective evidence is not clearly stated. There's no examples of that given in the law, so that is up for interpretation. But it has to probably be pretty compelling for your employer to start asking questions. Is the point, I think, here. So
I would add one thing to that, though,
Yeah.
which is, now if you don't feel safe or comfortable speaking up and coming out at work, that's fine, and you should feel perfectly safe keeping that to yourself unless it becomes important. But I do think that there is value in coming out, and that value is being counted and being seen. So self-identifying as queer or neurodiverse or both helps paint a better realistic picture of who is in a workforce. And it's hard to make decisions with senior leaders without data. I know that's a frustrating reality, but having self-identification is data, and it is helpful when trying to make systemic change. It is hard to advocate for an otherwise invisible populace. So again, where safety and comfort are involved, keep to yourself what you need to keep to yourself. But there are benefits and advantages to being open as well.
Thank you. That's such an important point, because Ash and I both work with the D&I communities at Red Hat, for example, and the very first thing that we get asked when advocating for our representative communities is, what's the data? What's your plan? How much of my workforce is represented here? So yeah, self-identification goes a long way for those of us who try to fight the good fight to make the workplaces more inclusive and better represented. It is just a fact of the matter. So that's a really good point. I wanted to cover mental health accommodations. It surprises me that a lot of people don't know that they can ask for reasonable accommodations due to a mental health condition, and it's very it can be very, very helpful. It does require you to come out, and there are risks, as Ash mentioned, but it can be really worthwhile. And if there's any chance that your performance at work could suffer or appear to suffer, even because we do know that these biases exist, you want to seek accommodations and get something on record with your company sooner rather than later. It's just a smart thing to do. So I've actually asked for accommodations at work, and this is some recommendations that I would recommend. You want to ask your supervisor if you do not feel psychologically safe with your supervisor, you feel like they won't get it. An HR professional or an employee relations professional should. So those are kind of your points of entry. The biggest advice I would give you is that this is the start of a conversation about your mental health. This is not. I wouldn't expect to say, hey, I need to change my working hours because of my mental health condition, because my depression makes it hard for me to get out of bed, and just have it be accepted and end of story. Typically, there will be some dialogue about it, and you should try to get that dialogue captured in writing. I've linked here a template to a accommodation request that I hope will be helpful for you, and have a few ideas of what might help you. Like I'll give some examples on the next slide, but really think through what am I struggling with at work, or what might I struggle with? Is this an isolated incident, or is this a pattern? If this task gets shifted away from me, would that help? If I am managing this task in a different way, or if my manager's supervisory style was different, just think through what might help you. The law does acknowledge that your symptoms will come and go. So your condition, again, naming it or giving it, ADHD or bipolar or any kind of condition is less important than how you're able to work and how limiting your symptoms are. And as we're all at home, I thought it might be important to mention that you can request accommodations in advance of returning work. So if you're feeling anxiety, I know I certainly am about coming back to the office, you might want to speak with your supervisor about requesting accommodations to continue working from home for a little while, or take half of your meetings from home, or whatever might help you. And that goes for coming back from paternity leave or maternity leave, anything like that. If you're coming back from mental health leave, you can request accommodations for any time period. So these are just some ideas. A lot of these apply to working in person, I feel, but there are certain things that you can do from home, such as you can ask your company to provide white noise earphones. You can ask to change non-essential job tasks with another employee, and this is under the anxiety section, or ask for a change in management style of your supervisor. You may want to have that conversation with an HR professional. You can ask for more frequent breaks for medication management, or a part-time schedule if you're seeking treatment. And you can ask for more frequent reminders of tasks and due dates. I know I've got a lot of concentration and distraction issues, and I always ask for due dates, and I always ask that due dates are given to me so that I can prioritize and make sure that I'm performing well, because there is a sense of personal responsibility in this, as well as what your employer is responsible for you. So there's loads more ideas here. If you do any kind of Google search on accommodations, you'll find a lot of ideas. There's really ways you can get help. You shouldn't need to feel helpless or like you're underperforming and there's no resources for you. So the rights applying locally and protections elsewhere in the world, there are states' rights that are stronger than federal rights. So do your own research in your state. I've linked to Wikipedia is an amazing resource for this. They have broken down by states, countries everywhere in the world, all the LGBTQ plus rights. If you feel your rights have been violated, and if in regards to your gender identity or sexuality, I've linked here. You can contact your local affiliate of the ACLU. And the Equal Employment Opportunity Commission is who helps regulate your rights to protection for your mental condition. So you can have that resources as well if you feel that your accommodations aren't being met or you're being discriminated. Hopefully it will not come to that. Oh, that's my Spotify. Sorry about that. All right, so this is a big one, talking to your managers and coworkers. We talked about coming out. So when you're ready to come out, this is when this kicks into gear. So I love this quote: live in the knowledge that you are a gift to the world. And I put sharing yourself here because I really do feel that to be open and vulnerable with someone and to be out with them, especially, it's the greatest gift that you can give someone. I think when we experience freedom with other people and we experience another person's authenticity, it just opens all the doors to be able to be more and more authentic with yourself. And, it just amplifies that ability to be open. And so it's truly a gift you're giving to someone. And I just would encourage you, if you haven't come out, to think about it that way. And if you are out, to think what great gift you've given somebody, which is your true self. People can respond in several ways. They can tell you that a friend is gay or has a mental health condition. That's just them trying to wrangle with the data they've been given and relate it to something they know. They may talk about their own experiences. Again, just trying to build some compassion there, compare their story to yours, and they may be off base. Let that, Lord knows it happens. Like, I know what it's like to be depressed. I, had a really bad day last week. Well, my clinical depression is that I have a really bad day pretty much every morning. And so, or if you have a cyclical mood disorder, it can look even differently. So just know that there's an effort to empathize happening, and they may just accept it as a fact and move on as well. Really think through what response would feel best and what this individual person may do, because again, you'll have to have the conversation multiple times. So think about how that person might react, because again, you're giving them a gift, and you don't want to give them a gift if they're going to throw it back in your face. Going back to psychological safety. So I wanted to share with you another resource coming from a software community. Red Hat is an open source software company, and open source code is code that's made freely and available for possible modification and redistribution. So when you read through the code, an engineer may still have questions, just like your peers may have questions for you when you come out. And the idea is that when you contribute to the code, you're going to need someone to explain your decision making. You're going to need background on why this is developed, what the user case is, and why things are the way they are. And to have effective collaboration, you really need a shared understanding, trust, and boundaries to be established. And that's regardless of your identity. It's just good practice as a professional. So a wonderful person at Red Hat, who's a leadership in the neurodiversity community, Aiden Camies, started writing a user guide for himself. And it covers his values, his quirks, his preferences in communication, and how he likes to work, versus a noisy versus a loud environment, a team environment versus on his own, a bit of history about himself. any kind of details about your life, you have a cat, you have a dog, things like that. And then details on your identity. It's a good idea to have down in writing, and maybe it's a way you want to operate if you feel comfortable to say, yes, in my case, it would be, I am bisexual and I have depression and anxiety. Here are the things you can ask about with that, and here are the things you can't. Here are some misconceptions. And you can give this to your manager, you can give this to your peers, and it can be as short or as long as you want. Again, that user guide, this deck links to the user guide for the individual, and then there's also a user guide for the manager. So if you're in a leadership position, it's just as important for your subordinates to, subordinates isn't a great word, that makes it sound very hierarchical, but the people who report to you, it's a good idea for them to know where you're coming from as well. So this can help establish boundaries, and hope you find that useful. And that concludes the content portion of our presentation. It was a lot of data, so I hope there's some questions. I haven't been able to keep up with the chat, but Ash, have you seen any questions, or do you have any last thoughts to add to any of this content?
I think it's really important to know what your own limits are, what your comfort level is, and what your rights are. I know that I've had my own experiences in the past of not knowing my rights and being railroaded by bad employers. And I'm grateful that Red Hat has been an employer that has both educated me and defended those rights. But I think this is so important for people who are not working in quite as safe of an environment. I think it's also important to note that the law does not necessarily protect you from being discriminated. It just means that you have recourse. And there is a reality that discrimination may happen and that not all places are safe. And in those cases, try to find a network of people is the best thing I can say. I've been in those spaces before where would have loved to have had a safe employer, but I wasn't in one, and I wasn't in a position to find one. And my network is what got me through that portion of time. So don't suffer alone. And as we were saying last week as well, find a therapist. Like, my greatest tool through all of this has been having a therapist I see regularly to talk through these things with, to level with me. And a therapist, as a licensed professional, also will know your rights, and is someone that you can talk to about that as well. So that's kind of my closing thoughts on that. There have been, let's see, there were only a couple questions that just came in. I don't believe I missed any before that. So here's a good one. What can we do if we can't find an ERG at our workplace? It's a very good question.
That's a great question. Start one.
Yeah, I was going to say the same thing. Start one.
Yeah, I mean, easier said than done, right, Ash? Like, I mean, I think you and I both put in a lot of hours into what we do. But going back to the point about building a community, the first thing we did with neurodiversity, and I didn't start it, it preceded my time at Red Hat, but we moved to a new chat platform as the standard. You moved to Google Chat, and you can create rooms. And so someone created, I think actually Aiden, who I referenced earlier, who wrote the user guide, I think he made it, and it was just a mental health chat room for people to check in with how they were feeling. And it really provided like a respite for people from their day-to-day lives and to feel understood in their neurodiversity. And now it's got 476 members in it. And I really feel that it helps people feel less alone. So if you have tools you can use, technology is a great way to connect. I would lean into those and try to find, set up some, even just like monthly meetings with your, with people you find, just coffee breaks or things like that. Yeah. But it's hard when you don't have that type of representation, but it's so important. And it's very important for businesses, again, with retaining talent. Like, any HR department worth their salt these days should have ERGs established, and if not, they should very quickly be doing so. diversity is very, very hot right now. You know, George Floyd changed the world, and so companies are under increasing public pressure to put resources behind this. So you may have more resources than you think if you talk to your HR departments. You may have a lot more resources than you think. They may just be waiting on the right person to come along to start something. You never know.
Yeah. Yeah. I have nothing to add to that. That is a really good answer.
Oh, gee, thanks.
So let's see. Next question. What is something your employer has done that made you feel psychologically safe early on? And I actually have a good answer for this one, I think. So I came into Red Hat and I left engineering to go into sales. And that was a personally and professionally terrifying thing to do. And it was really, really tough. I also, at the same time as the transition in job, had a medication issue as I was trying to transition between doctors, and I wasn't able to continue seeing a psychiatrist regularly. And I ended up under medicated, and I ended up having some severe anxiety backlashes to the point where I wasn't sleeping or eating for a while. And I was able to level with my manager about it and just tell him flat out. So, look, I have made the mistake in the past many times of not acknowledging this and letting my management think that there was something much worse wrong with me or going on. I just want to explain what this is and what I'm going through. My manager was so incredibly understanding and gave me all the space in the world to find my recovery and to get back into the swing of things. He was very encouraging, and that's what I want. That's what I would expect of a manager. Someone who says, "Wow, I'm really sorry to hear about what you're going through. How can I help you? What is it that we can take off your plate? Do you need me to get your meetings covered? Do you need to take a couple of weeks off? What's going on here?" That was such an incredibly empowering conversation to have, because since then I've not been afraid to have this conversation with my managers, with people I work with. Whenever I was assigned to a new sales rep, I had to have this conversation with them too, because travel would often, although I was traveling 60% of the year, 70% of the year, there were times that travel made me so sick, anxious that I couldn't function, just because of the stress. And it was always a good thing that I found the psychological safety to have a conversation with my manager, and that I was able to have the support and backing of essentially everybody within my reporting chain.
That's so awesome and so special that you were able to get that kind of support. I don't know if I have a great answer for this question, because it's always like the psychologically unsafe stuff that stands out, you know, like you're more apt, that thing where you're more apt to leave a bad review than you are to leave a good one. Um, but Red Hat has definitely been a huge step for me, and as far as being out. So I'm glad that was your experience too, Ash. Um, somebody in the chat asked whether the EAP, anyone had contacted the EAP. I reached out to them, and I can share that experience, but I wanted to know, Ash, have you used the EAP yet?
I actually have not. I've never had an opportunity.
Awesome. It's good. It's a great resource. It can be very useful in a lot of ways. It connected me to a therapist who didn't end up being a match for me, but it was a very quick process of getting to a therapist rather than doing my own online research and then going and making a visit and then deciding they weren't for me, and going through like a wait list period. They connected me with a therapist. I was in an appointment next week. I called the hotline and they asked me, what I was going through, and what I felt I needed. And I told them, and I was just going through a period where I was just extremely overwhelmed at work, and I was not feeling a high sense of like, I was having like a hard time with my self-esteem, and it was kind of my depression and anxiety attacking me all at once, and it wasn't going away. It had been several weeks, and it was early on in my time at Red Hat, so I hadn't had that conversation with my manager yet. I was still kind of feeling everybody out, but I found out about the EAP, and yeah, called them, was in a therapy session next week, felt a little better. the therapist didn't end up being a great match, but it did prompt me to continue to use my benefits to find another therapist and try to find somebody. So I can't recommend the EAP enough. And the fact that it's 24 hours, the fact that I could be having a panic attack at 2 o'clock in the morning and call and set up something for the next week. It just is a really great resource. So I can't say enough about that. I am kind of scrolling. Ashton, do you want to talk about? I know you have a lot to say about therapy. Do you want to share anything about your experience finding a therapist, or?
Oh yeah. So again, coming back to psychological safety, finding a therapist is a very important process. So obviously we're here talking about intersectionality, right? So I'm a gay man, and I have a personal history with extremely damaging religious rhetoric. And I have a lot of post-traumatic stress issues with especially evangelical religion and expression therein. This is not a great time to be in America right now for me.
Yeah, no doubt.
And so when I search for a therapist, I have to search very hard to find a therapist who is at the very least not Christian. And I know how this sounds, and I am sorry if I'm touching on something. This is a very valid, I think, conversation to have. I uh, Finding my therapist was not easy at first because I live in a place that is extremely religious, and but I did find one, and I find that my feeling of safety talking with her is unquestioned. She's not a-religious. She's just not uh, she's just not sort of that fundamentalist religious, and that means that she understands religion enough for us to talk about it and for us to talk about my experience with it, and yet at the same time, the conversation, I know and I trust the conversation is never going to turn back to, but have you talked to God? Because that was always the answer up until the point I started seeing therapists outside of religion. And I think that was really important for me to be able to process and move past my discomfort with religion and outward expression of religion and things like that. And in the last couple of years, working through that with this particular therapist, that really has helped me. So I think making sure that you pick a therapist who's right for you is really important. And looking at it really like you are finding someone who you want and need to know you very deeply. You need to be able to trust them. And vetting your therapist is not a thing you should be afraid to do. I called many therapists and I just asked point blank questions, and every single one of them was completely understanding of what I was doing and why, because they know too. They know that people need to vet their therapist. So don't be afraid to do it. Don't be afraid to be specific. And right now, don't be afraid to look outside your area either, because although across state lines things can be difficult, you can look for someone many miles from your hometown in your own state and do e-therapy. 2020 kind of made e-therapy available to the world in a way that I don't think it ever would have been without a pandemic. So I think that's what I would say on that note.
Yeah, I couldn't agree more with like the accessibility that has changed over the past year. Like if there's anything it's given us, which is so many lovely gifts. But one thing that is in sincerity a great gift is the rise of these programs and accessibility to mental health help. I mean, I'm getting pushed stuff on Instagram constantly about like text therapy and email therapy, and I know there's BetterHelp. There's Talkspace. In a lot of times, those can be subsidized with insurance, depending on your provider. It's a pain in the ass to get on the phone with your insurance provider, but if you do, it's a very worthwhile effort to help you find somebody. I have to share this experience. I went through, I think in the Raleigh area. I went through, I think, 5 therapists before I finally found one. Then I was like, yes, you're the one. Because as Ashton said, it's like you need to want to be friends with this person, almost like you're really vetting them. But I finally found one that was like the one for me. But before that, I met with a therapist, and Ashton had the right idea to call before you go, because I set up an appointment to do it in person because I wanted to get a read on this person in person. And she proceeded to tell me that she believed transgender individuals were working out their past lives, and they had been the different gender in their past life. And I think I got up and walked out. I was like, so you're gonna have like extreme situations where bad things, you may encounter, I would say, bad people or at the very least extremely misinformed people. And you kind of got to roll with the punches and you got to keep going. I mean, that totally detracted me, and I had to have my friends start nagging me again to find a therapist because things were starting to get bad again. And Allie DeVolder, who's on the call, was actually one of those people who was like, okay, yeah, she sucked, but you need to keep looking. And it's hard to do when you have a mental health condition. A lot of mental health conditions can be prohibitive, but you want to keep pushing until you find the right person, I think, is just the last thing I'll say on that. Because there's somebody out there for everybody. One of the questions that we had prepared, and Ashton, I'm curious your thoughts on this. Do you feel you're able to show up as your whole self, or do you feel that you're only able to show up in certain identities, or do you feel like one identity is more accepted than the other? And this can be outside of your Red Hat experience as well.
That's a really, really great question. Because I don't think I would have been able to answer yes until the last year. The last year, I think 2020 made me really consider my priorities and put things in order and be less afraid to live openly. And I found that I was fortunate that living openly didn't backfire on me at work. It has backfired on me in many other places. There are places I cannot take my full self. There are places in public where I live where my full self, my out and loud self, could be met with violence. I do not live in a terribly safe place for queer people. And it's a thing that I'm working with my city to try to address. But the spaces that I value the most are the places where I am and can be. And, am I going to just, not all of my identities necessarily are, quote unquote professional, right? I mean, I'm an activist. I bring activism to work. And that's a thing that I appreciate. I am queer and I bring my queerness to work, and that's a thing that I appreciate. I don't it's not necessarily that in every meeting I am loud and gay. It just means that I don't feel like I have to put on a face anymore. I don't have a face to put on. I dyed my hair this year. And that's an expression I've always wanted to have, and I just became unafraid to do it. And I found there was a great deal of acceptance. Sydney has purple hair. I have orange and purple hair. I found there was a great deal of acceptance to that. And this year I actually felt quite a bit of safety in being able to show up as my whole self. And I will say too, coincidentally, on the topic of religion, that there are actually religious spaces where I'm able to bring my full self too. I am a professional musician, and well, at least I used to be before there was no such thing as professional music gigs anymore. And I sing in choirs. And one of the most reliable gigs that any chorister ever has is a job in a church. Welcome to Cognitive Dissonance 101. And where I ended up was an Episcopal church in San Diego that was one of the most queer affirming, open, and fantastic spaces I've ever been in. And that includes secular spaces. And so there are other places too where I found that bringing my whole self was both welcomed and appreciated. And I found that those are the places where I am my most authentic, my most productive, my most at ease, my most happy. And they're the places I want to go back to.
Yeah, that's such a good feeling. The not having a mask on feeling is it's really special outside of work, and it's critical outside of work. But in the office, like, you just never know what you're going to get, and it's so important to feel it in as many areas of your life as you can. So I love that. I love that you feel that this past year has been good for you in those ways, because it's just so important to feel like yourself all the time. I'm curious how you mentioned having safety and feeling more safe now than you had in the past. How do you suss out safety? And I'm kind of trying to work this out for myself too, because I feel like I may rely on a lot of bias to suss out safety. Like if someone starts talking about religion or God, I may assume that they wouldn't accept my bisexuality. If I hear people use language like crazy, I might not assume they would understand my depression. How do you make those determinations?
It's a little bit like walking on ice. You
Mm,
put your foot out, and I mean, sometimes you can kind of tell whether ice is thin or not, right? But sometimes you can't. And
mm,
for me, it just took a deep breath and some self-assurance and some forethought to say, no matter how this goes, I'm ready to take a step, and I've taken my step, and one step at a time, I find where my safe spaces are.
mm,
And I think in my experience, there were more of them than I expected. I can't say that's a universal experience, but there are a lot more spaces that were accepting than I thought would be when I began living more openly as myself.
mm. I love that. Yeah. It is kind of a trial and error, and takes a great amount of fortitude to step forward into authenticity, especially when you have no idea. You can guess and try to mentally prepare yourself for how someone's going to respond, but you never really know. Um, I think that's a great I think that's a great note to kind of start wrapping us up here, unless there's other questions in the chat. I wanted to give a plug for NAMI's young adult support group. So this is any young adults 18 plus with mental health conditions who also identify as LGBTQ plus. Um, this is peer led. There are people joining from across the country. This is a great program, and if you don't have an ERG at work, this could be a great resource for you. So I wanted to give us a plug to that. Ashton, do you have any last words, or anybody from NAMI or the LGBT Center want to pop in for any last commentary?
I have something I think would be good to close with. So if there's anything from NAMI or LGBT Center, go ahead.
Yeah, I would like to say this is Peg with NAMI North Carolina, and it's not allowing me to share my video, which is totally fine. But we have opened the support group up to all adults. Young adults are certainly welcome, and they're still the bulk of who we get, but any age is welcome.
Awesome. Thank you, Peg. Thanks for that distinction. We'll have to get an updated flyer from you all for when we plug it next time.
I just wanted to say thank you, everyone, for speaking, especially Sydney and Ash, and sharing your story and all this information. It was a very helpful presentation, and I'm happy that it's recorded that we can share with others.
Thanks, Annie.
Yeah. Thank you for the partnership opportunity. I want to see more of these kinds of partnerships. Actually, I wasn't really all that aware of NAMI before this, but I've just joined up with the chapter in my local area. So thank you for the outreach.
Yeah, thanks everyone.
And I just wanted to say, this is Corey with the LGBT Center of Raleigh. I mean, this has been really great to hear some experiences, at the workplace and professionals settings. If anyone is looking for, any sort of other types of programs or groups, the center does have a lot. We have a lot of programs, and we're constantly trying to restructure, rethink how we do things. So any interest or any interest in being involved in any way, you could just let me know. I will go ahead and put my my email in the chat. And even if you just have questions about maybe some of the other initiatives and things that we have, please don't hesitate to reach out. Thank you.
And Corey, if we have people joining from other parts of the country, you'd be able to kind of direct people to other resources as well, right?
Absolutely, yes, yeah. We will definitely, we have a couple people that help out with resources and helping you find different things, even if you're in different areas. But with everything being virtual right now, I think that makes it a lot easier.
Yeah, for sure. Thank you. All right, Ash, what did you have on your mind to close us out here?
Just the last question that we'd had prepared. What are ways people can create more inclusive work groups, departments, and communities? Because I like the idea of this closing with a what can I do? Um, I have a couple of thoughts, and then of course open to the rest of you. I think one of the most important things that anyone can do, although especially for allies, we're looking for accomplices as we joke, right? That allyship is an active activity, and all of us are allies. Everyone, even those of us in the community, we are allies for each other. And I think one of the most important things is to try to hold psychological safety as of paramount importance in your spaces. And that means when people are not in the room. That means defending people's pronouns when they're not in the room. That means shutting down words like crazy, shutting down people who use the word schizophrenic to describe something that is just chaotic.
Or OCD.
Or
to describe
OCD. Oh my goodness gracious. Yes, that one is that one really bugs me. You know, that's how we create these safe spaces. It's a lot about language. But also I think just listen, listen to the lived experiences of others and provide space for people to have and offer their lived experience. I think those are the very important things that we can do to create safe spaces.
I love that. I think that's a perfect send off, a nice actionable thing for whether you're an ally or whether you actually identify with these communities, listening and just being really expanding our awareness, being more conscious. So thanks everyone for joining today. This was recorded, so we will be distributing it in a couple different places. I think it'll be on the LGBT Center of Raleigh's YouTube page. So thank you all really for joining. It is a small group, but we hope this was meaningful. And just have a great holiday break, however you celebrate, and be safe.
Thank you, everybody. Happy holidays.
Thanks. Bye.